Thank you, Sue, for the introduction. I appreciate it. So I am Dr. Canto, as advertised, and I have a short presentation. And we will certainly have time at the end of after the presentation is over for questions, and I'm happy to answer them this evening. So thank you for attending. I appreciate your interest, and we'll get started. So this is who I am. I'm board certified in general surgeon up until 2021. I was practicing full-time general surgery at Wing Hospital, later became Baystate Wing Hospital from 2001 to 2021. I am practicing wound care exclusively now at our wound care center here, and also the satellite centers that we have. I did my general surgery residency at Berkshire Medical Center in a different decade. And an internship in the Boston University program. So I've been in New England pretty much close to 30 years, medical school in North Carolina, and I'm originally a transplant from New Jersey. So that's me. I don't have any disclosures. I don't have any financial interests in any of the products that we're going to talk about here, other than using them in the wound care center to help my patients. So this is sort of an overview of what I was asked to talk about and what we can discuss, and then we can discuss anything that has to do with wound care after the presentation's over if I haven't covered something that you're interested in or have a question about or an issue with. So the first part is home care of wounds. How can you take care of your wounds in your own home? There are do-it-yourself kits available in your medicine cabinet, I'm sure. We can discuss some of those because those get mixed results, and we see a lot of the failed ones of those come here to see us after they've tried everything else, trying to avoid coming here. When to seek urgent care or emergency room care for your wounds. Some wounds just aren't amenable to do it yourself, despite what the people at Home Depot say. When to talk to your PCP to have your wound evaluated or cared for. If there are questions, obviously, they have a little bit more facility in evaluating the wounds for infection and things like that. And then, of course, the wound care center. We care for wounds all the time, and we've seen, I won't say every type of wound, but we see a lot of wounds and can deal with most any kind of wound in one of our centers here. So we'll launch into that. Here's the home care of wounds. Okay, these are the high points of caring for your own wounds. Obviously, hand washing is important, whether you're taking care of your wound or a family member's wound. Wash your hands with soap and water, and then hand sanitizer or something like that would be appreciated as well. Stop the bleeding. Usually what you have to stop the bleeding at home is just pressure, which is very effective. Putting pressure directly on the wound, trying to see where the bleeding is coming from and pressing directly on that area, and then holding pressure for several minutes to just get all the bleeding to stop before you start manipulating the wound. In surgery, we do have a saying that all bleeding does eventually stop, but it's better to stop it when you want it to stop than just wait for it to stop on its own. Cleaning the wound. It is helpful to clean any bacteria and soil that might be in the wound after the injury, because let's face it, most of these injuries don't happen in a sterile or a clean environment. Antibacterial ointment. Should we or shouldn't we? We'll talk about that. That's a whole separate topic. Protect the wound. So choosing a dressing, actually not just a dressing, but choosing the right dressing for the right wound. Wounds are not one size fits all. There are many different types of wounds and many different types of patients with those wounds. And so it takes some care to decide what the appropriate dressing is to help the wound heal and not cause further injury or damage. How often to change the dressing is another issue. Observing for signs of infection. Obviously, these wounds, again, don't happen in sterile environments like in the operating room. So an infection is a bad thing, especially if you have some risk factors for worsening infection, such as diabetes or poor circulation. So that's another pitfall to managing your own wounds. When should you seek medical care in any of these other venues? And we talked about some of them: signs of infection, uncontrolled bleeding. I just can't stop the bleeding. If I hold it, it stops, but when I let go, it continues again. Or even pulsatile bleeding would probably be an indication to seek more professional care, because there may be a larger or an important vessel that's been injured with the injury. Necrosis of tissue, if there's obviously dead tissue in the wound, or if there's a lot of foreign material, dirt and rocks and things like that, it might be better to have the wound anesthetized and cleaned out in a controlled environment like the emergency room or an urgent care center. Non-healing wounds. How long should a wound be before it heals? Again, that has a lot to do with the kind of wound. So a simple laceration where you cut yourself with a piece of glass, that wound should heal in a week or two. Not completely, but it should be pretty well sealed and healed by 2 to 4 weeks. After 2 to 4 weeks, we start to be concerned that the wound won't heal, or if it's a larger wound that requires more care, then again, after 6 to 8 weeks, they're considered chronic wounds, and we see a lot of chronic wounds. You'd be surprised how many patients we see with wounds that are 3 months or 4 months old, that they've tried everything else and been everywhere, and then come to see us. And then deep wounds. If the wound clearly penetrates to some structure that you don't recognize in the depth of the wound, like a tendon or a blood vessel or the bone, then obviously going to the hospital, that may need to be repaired in the operating room. It certainly needs to be anesthetized and explored to make sure that something major hasn't been injured. So that's for the home care. This is what your medicine cabinet may look like. These are some basic wound care things that are found commonly at home. We have an ACE wrap to provide some compression. We have a roller bandage to hold the dressing in place. So the dressing is what you put directly on the wound. The bandage is what holds it in place. I'm not a big fan of putting tape on skin, especially certain types of skin in certain populations. Putting on and taking off tape is a recipe for more skin tears and injury. So wrapping the dressing around, wrapping the bandage around to hold the dressing in place is actually, if it's possible, is actually the best way to go. So that's good for extremity wounds, taking care not to wrap it so tightly that you cut off the circulation. We see little gauze pads here. For chronic wounds, the gauze pads don't have to each be individually packaged and sterile. They can be just clean. You can buy them in bulk. That way they're cheaper. This is some paper tape, which is a little more gentle on the skin than, say, these other things, which are Band-Aids. Band-Aids are very irritating for skin, especially if you're putting them on and taking them off every day or a couple of times every day. They can actually injure the skin, and we see a fair amount of dermatitis or inflammation from the adhesive and from putting on and pulling off the Band-Aids. There's some ointment here that you can't really read this, but this is bacitracin ointment. It's a type of ointment that a lot of people use. It's also known as antibiotic ointment. It's one of the 2 or 3 more common ones. The other one that people have a lot in their household is Neosporin. Those contain antibiotics in a petroleum base. The 2 bottles in the back, alcohol and peroxide, those are the things that are commonly available in the house to clean wounds. I recommend not using either of those for open wounds. They both are non-selective killers of cells. So yes, they will kill bacteria, but they also will slow down the healing process because we're asking some very young, new, delicate cells to grow across the wound. And if we're constantly dousing them in things that are caustic or toxic, they stop and recede and then have to go again. So I see a lot of patients here as well. I've been washing it every day with peroxide or washing it every day with alcohol, and it still hasn't gotten better. And that's your answer. And then, of course, the gloves. It's always good to have personal protective gear of some sort, even if it's your own wound. It's nice to have clean gloves on when you're working with your wound and your dressings. They don't have to be sterile, but they can be clean. If you're working with somebody else, obviously, it's for your protection and their protection. You still should wash your hands with soap and water before using the gloves in case there's a hole or a penetration in the glove. So that's your home medicine cabinet. Here are some reasons why perhaps you'd like to go and seek out urgent care or emergency room care for your wound, because a lot of these wounds happen at inopportune times. Your PCP or even the wound care center may not be open. You get cut in the middle of the night or while you're out, playing on the weekend. If the wound is gaping, a good rule of thumb is if you see the wound and gently try to pull it apart and it easily opens up, it probably needs to be approximated in some fashion. That may mean numbing it up and getting sutures, which is beyond the scope of most people's home care. I have sutured my own wounds, but I don't recommend it. If the wound is deep enough that exposes subcutaneous fat or tendons or bone or things that you don't recognize in the wound, then obviously that's a good reason to seek out emergency room or urgent care. If there's obvious dead tissue in there that may need to be cut before it can be approximated, then that's a good reason to go. Deficits, if there's numbness or something that used to be mobile is no longer mobile, like my finger doesn't straighten anymore, or something that wasn't mobile that is now, like your ear is hanging off or a piece of the tip of your finger is hanging off, those are good reasons also to go to an emergency room where they may have to be fixed, even potentially in the operating room. And then lastly, vascular compromise. If the cut goes into a major artery, even if it stopped bleeding, if an artery can be transected and can therefore not be bleeding into the wound. But if the parts distal to or further downstream from it are turning white or blue, that's a sign, it's a dangerous sign, and it needs to be probably repaired in the operating room. And then lastly, of course, I said uncontrolled bleeding. We spoke about that before. That's another reason to go to either urgent care or the emergency room. There are ways that you can approximate wounds at home if they're gaping a little bit, but you really don't want to or can't really get to an emergency room. Steri strips are a nice over-the-counter product that can be placed across a wound. If you clean the wound adequately with soap and water, is fine to clean a wound. Certainly tap water or saline can both be used. They're both safe, and tap water is just as safe as saline to irrigate wounds with. Studies have shown that as long as it's clean tap water. And then approximating the wound with steri strips, they're a little bit harder to take care of than sutures because you want them to stay on for a week or two, so you have to be careful not to pull them off or have them roll up or things like that. But it's certainly an acceptable way to approximate simple wounds that just maybe are gaping a little bit too much and you can't get to an emergency room. We talked about things to put on your wound, and we showed this bacitracin. Ointments like that, even just Vaseline, are fine. The difference between Vaseline and Neosporin is that a lot of people have allergic or develop allergies to Neosporin. So I've seen some pretty bad dermatitis cases, a lot of swelling and redness just from repeatedly using Neosporin on or around a wound. Similar things can happen with bacitracin. And if antibiotics aren't needed, I encourage not using them. So something like Vaseline, like Aquaphor or a Vaseline type ointment that's made for wounds, is probably better than just bacitracin. And my favorite that I use in the wound care center is something called Zero Form Gauze. This is a gauze product that's impregnated with petrolatum and bismuth. So the bismuth helps keep down the bacterial count. The petrolatum helps keep adequate moisture on the wound. And it's easy to change, and it doesn't stick to the wounds. So that's a nice dressing. And then you would cover it with another dressing like a gauze and a wrap to hold it in place. Those are very good options for home wound care. Studies have shown that wounds heal better when the wound bed is kept moist. So obviously a laceration that's closed, you don't necessarily need to keep that wound moist, but if a wound is open, such as an abrasion or a tissue loss type of wound where there's a skin tear and some of the skin is missing, keeping the wound bed moist is far superior to allowing it to dry out. Wounds will heal under a scab. I know Mom said not to pick the scab off, but we do pick the scab off regularly here because the wound heals faster without the scab if you can keep the wound bed moist with one of these preparations that's designed to keep the wound bed moist and healthy and promote migration of tissue to close the wound definitively. Going to your PCP. Most PCPs are not that comfortable with taking care of complicated wounds. But for example, if you're observing the wound daily, like we talked about before, and it looks like it's turning red and pus is starting to drain from it, it's becoming tender, or you're starting having a fever, then obviously if it's during the daytime, you can seek out your PCP and see if antibiotics are appropriate. If it's after hours or on the weekend, then obviously the emergency room would be a good place to go. Wounds that fail to heal normally, 2 to 4 weeks, like I said, should be adequate to at least be well on the way to healing. Wounds that go out 6 or 8 weeks, it might be good to inquire from your PCP. Hey, can you take a look at this, or can you get me into one of the wound care centers or give me a referral? And then patients who have comorbidities, we see a lot of patients in the wound care center with many of these comorbidities. It just means that it's harder to heal the wound, and a lot of these patients don't resist infection quite as well. So they're at higher risk for infection and higher risk for bad things to happen when infections do occur. So PAD is peripheral arterial disease. People who have blockages in their arteries and have insufficient circulation to their feet or distal extremities, they may be at higher risk for wounding and non-healing wounds, and sometimes that needs to be corrected. And we work very closely with our colleagues in vascular surgery for those patients. The same is true with diabetes. Diabetics, especially poorly controlled diabetes, are at very high risk of non-healing wounds because they don't heal as well and are at higher risk for infections that can become limb or life-threatening. So early intervention for those would mandate going to see your PCP or another medical professional. Collagen, 2 to 3 weeks. 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 2 to Collagen diseases are a little bit more rare. Those are less commonly seen. These are the patients that, as I just said, these are the patients that we see commonly in the wound care center. Diabetics, very commonly, they have problems with neuropathy or inability to feel the distal portions of their extremities, so they're at high risk for developing ulcers and wounds on the bottoms of their feet, and don't even know it. Many a patient comes in and says, I didn't even know I had a wound on the bottom of my foot until I saw blood in my sock or my shoe was wet and I looked at the bottom of my foot, and they have a $50 sized hole in the bottom of their foot that's been there for already weeks. Similarly, PAD, insufficient circulation. If that's a problem and the wound isn't healing, then that needs early intervention. And as I said, we work closely with our colleagues up in the vascular surgery department to get those worked up and corrected if possible. And then venous insufficiency is another common thing we see here. People who have insufficient venous return tend to get swollen distal extremities and can develop ulcers, which can be very hard to heal. And that also requires some vascular input sometimes if it's a correctable cause of insufficiency. So we see those patients quite commonly in the wound care center. I recommend referral earlier rather than later for those problems. We have many ways to enhance the healing ability of those wounds. And so we are available for consultation for those wounds at any time. Any history of poor or delayed wound healing, some people just don't heal wounds well, and we can facilitate that because we have many things that we do to help wounds heal. So if your wound has failed to heal, certainly in 4 to 6 weeks, and you're worried or your PCP is worried, we're happy to see you at the wound care center. We were deemed essential during COVID. We were open every day during COVID. Sometimes we had decreased ability to see patients and saw more emergent patients and had to put other patients off because some of our staff got COVID and we were not at full strength during COVID, but we were there to help manage wounds even through the worst parts of COVID. This is something that we have at the wound care center. These are the 9 essential steps of healing. Every wound that we see and every person that we have that comes in that has a wound, we go through these steps to evaluate the wound and to tell if they need some other adjunct that we have available here to assist with their healing. And I know you can't read that, but it's something that we use, and it addresses things such as peripheral circulation, diabetics, adequate nutrition, offloading. If you got an ulcer on the bottom of your foot from walking long distances in your shoe, if you continue to walk long distances in that shoe, it doesn't really matter what we put on the surface of the wound, but that wound's just not going to heal unless we can adequately offload it. So offloading is important. Reduction of edema, that's the ACE wrap or the compression that we use. These are all steps to be examined and then corrected so that we can optimize the ability to heal these wounds. This is our medicine cabinet. That's why it's better to come to our place, come to our house, and we'll use all of this to help you. This is actually only half of the closet. The other wall I couldn't get in the same picture. But these are all the various dressings that we have. As I said, studies show that wounds heal when the wound beds are kept moist, but not too moist. So these are all ways of either adding moisture, preserving the moisture that's there, or taking away extra moisture, and also compressing the skin to minimize edema and to enhance the ability to heal. This is, again, addressing a lot of the things I've already covered. The standard wound care is based on these 9 essential steps. And I wrote these down here so that you could see them because I know you couldn't read the chart that was on the wall. But these are all the things that we address. In addition to that, we have some advanced dressings, collagen-type dressings, which add collagen to the wound. It's important for your body to be able to make collagen to help heal a wound. And sometimes the things in the wound prevent your body from making collagen. So we can add collagen to the wound to take some of those bad humors out of your wound so that your normal healing process can take place and your collagen can bridge the defect and close the wound. And then we use some advanced modalities. Most visits involve a debridement of some sort. We use a topical local anesthetic and debride the wounds because wounds that have bacteria and dead cells and dead tissue on the surface heal much slower and are at increased risk for getting worse. So most visits involve cleaning all of that out of the wound, getting the wound bed ready so that we can treat it with the various dressings and get the wound to close. Skin substitutes are the next step up. in our care armamentarium. They involve actually collagen tissue from usually other animals. So we have bovine and ovine skin substitutes. We have some human products, placental tissue, and even infant skin that's been harvested and cultured to use to help enhance the ability to heal wounds. And we have all those available. And this is usually done in sort of a triaged or a stepwise fashion. We do the basics first to see if we can get the wound to heal, and then try these other modalities as we go along. The last one there is HBO. I know everybody's doing streaming these days, but this is a different kind of HBO. This is hyperbaric oxygen therapy. It involves breathing oxygen at 100% concentration at higher than the pressure that you're able to breathe it here at sea level. So we're at 1 atmosphere. Most of the treatments involve putting you in a chamber and pressurizing the chamber to about 2 or 2.5 atmospheres for up to 90 minutes or 2 hours. These treatments are very well tolerated. They do have some downsides, so it's reserved for certain indications where we know it will help. Insurance pays for only a handful of indications, and they've been decreasing the indications as we go. Here at Baystate, we use hyperbaric oxygen to treat wounds. We don't have a chamber that's amenable to take care of patients who have multiple illnesses, like on a ventilator in the ICU. Those patients have to be transferred to a place that have bigger chambers where nurses and ventilators and things can be in there. But we use ours to treat wounds. And the most common wounds we treat with those are diabetic foot ulcers, patients with either skin or bone that have been damaged by radiation therapy and now have open wounds that won't heal. Those are the primary indications. There's some indications for people who have peripheral arterial disease. Those are the main indications that we have here. I think I have a picture of the chamber that we're talking about. So this is one of the chambers that we used. We have 2 of these. The patient is loaded onto that gurney, which is then pushed into the chamber, and the doors closed behind them. So now you're in a sealed acrylic chamber. You can see outside of the chamber, so it's less claustrophobic. The patients are in there for 90 minutes to 2 hours. They are able to watch TV. There's a TV on the wall at the foot, so they can watch TV and have some sort of entertainment while they're in there, because you really can't bring anything else in the chamber with you. It's 100% oxygen. The risk of fire and bad things happen if anything else goes in the chamber. So we give you a pair of scrubs, and you and the gurney are the only things in the chamber. There is a technician sitting at the desk where that picture was taken, and they are there every moment that somebody's in the chamber to monitor the patient, make sure that there's no problems arising. We can communicate with the telephone that's there, and we can depressurize the chamber and get patients out if problems arise. So that's a typical HBO chamber. Patients have to be able to clear their ears and have to be not too claustrophobic in order to be able to undergo that. And it's 5 days a week, usually for 6 or 8 weeks, depending on the indication and what we're doing it for. We also do some education. So we take care of your wound, but then we help you prevent getting new wounds. Diabetic foot care. We don't do diabetic foot care, such as cutting of nails and paring of calluses, but we do explain the importance of that and help get our diabetic patients lined up with a podiatrist who can do diabetic foot care and surveillance to help prevent future problems, because it's much better to prevent a wound than it is to try and heal a wound. So we help our diabetic patients with that and getting prescriptions for shoe inserts and offloading shoes and things like that. Tissue offloading. We get a fair number of patients with pressure ulcers. So we help them getting offloading equipment for their wheelchairs and beds and things to help them heal their pressure ulcers and then to prevent future ulceration. And we see a fair number of people with venous and lymphedema. We help them with their compression needs, giving prescriptions. We don't dispense things here. So we're not a durable medical supply store. We don't dispense offloading shoes or cam boots or compression stockings, but we certainly prescribe them, and make recommendations and get you in the appropriate garments to help prevent future problems. So in conclusion, wound healing, whether home care or specialty care, that's what we do. Optimizing tissue growth by providing appropriate microenvironment in the wound. We talked about keeping the wound bed moist. but not too wet, providing nutrients such as oxygen and protein for wound repair, and the need for all the things that are needed for healthy tissue to grow and heal your wound. We are involved in preventing or treating infection in our patients. Again, debriding the wounds, removing devitalized tissue from the wounds. Those are all things that we're involved in here on a daily basis. Preventing trauma and preventing re-injury by counseling and helping get the equipment that's necessary to offload the area and prevent future problems. These are all the locations where we are at. This is some shameless promotion here. We have centers at Baystate Medical Center in the Wesson Building downtown on Chestnut Street. We have a center at Baystate Wing Hospital. That center is for wound care only. We don't have hyperbaric chambers there, but we are there 2 days a week, so to help the local people so they don't have to travel quite so far to get into Springfield and see us there. And then Baystate Franklin Medical Center has a full service center. They have hyperbaric therapy there, as well as all the skin substitutes, and they're a full service center there as well. So these are the contact numbers. Obviously, you can call Baystate Medical Center, and their access people can arrange to get you hooked up with the center of your choice in the location of your choice. So I think that's about all I have. I do. So now it's up to you.
Awesome, Dr. Canto. That was a great talk, and I learned quite a bit, and I appreciate it. I'm sure our attendees did too. We do have a number of questions already. We'll start with the first one, if that's all right. What's devitalized tissue?
So devitalized tissue is tissue that's no longer has a blood supply. So it's no longer really alive. And it's basically dead tissue. Leaving dead tissue in a wound slows down the healing process. Not only will that tissue not help with the healing process, but it will also prevent the healing process from moving forward. So it's very common for us to see patients come to the wound care center and they say, I fell and cut my leg and I went to the emergency room and they sewed it up and now look at it. And there's, for example, a flap and it was sewn down, but the flap has turned black. So that tissue is dead. And if it's allowed to be left in the wound in continuity with the edges will not try to grow across that because it's just devitalized or dead tissue. And so removing that will assist in the healing process. The healing process just won't move forward that way. And I see lots of patients who that their wound has been like that for, a month or two, and they finally come to see us. We debride the wound or remove that devitalized tissue, and the wound starts healing and it's closed within 2 weeks, like a normal wound would be. So devitalized tissue just means tissue that's no longer alive. There's a fair amount of things that are devitalized in the wounds once they become chronic. The film that forms on the surface of the wound is generally proteins that your body secretes, and it also contains dead bacteria and dead skin cells that kind of are in the wound. And that's one of the reasons why we try to debride devitalized tissues out of the wound so that we can promote healing, and also it helps prevent infection.
Wow, great answer. Thank you. The next question. Is there anything I can do to accelerate healing? Maybe moving a limb to increase circulation in the wound area?
So that can help to increase circulation. Certainly when you start using the muscles in your limb, it helps. Obviously, some injuries are not amenable to that. So people who have ulcers on the bottom of their feet, we don't encourage more walking. We encourage offloading those sort of things. Keeping the wound warm actually increases circulation to the wound, because when you might notice when your skin is warm, it's pink and healthy. That's because there's increased blood flow into the tissues. So keeping the wound area warm and providing a little bit of gentle but not strangulating compression will help get the edema out of the tissue. So the blood has a better chance to give oxygen off to the tissues rather than making it go through all the edema fluid that sometimes collects around the area of an injury. We like to get rid of the edema, so a little bit of gentle compression can also help with that. I would like to go back to the devitalized tissue thing. I did say that we cut the tissue off, and we do frequently. One of the exceptions that we try not to remove is a lot of older patients that have thin skin. They develop skin tears, and the skin will frequently roll up on the wound and will be coiled up at the end, and it will look devitalized. But if it's a fresh injury, rolling out the skin and putting it down with a couple of steri-strips will actually make the wound heal much faster, many times. So I've had patients go to the emergency room and they say, oh, they cut the skin off and now they have a giant wound that has to heal. And the skin has to migrate in from the edges. So if the skin cells are only going to migrate, say, 1 millimeter a day at best, and your wound is now 2 inches big, it's going to take a long time for those cells to migrate across. If you can actually put your own skin out over the wound bed, get rid of all of the blood underneath it, and tack it down with some steri-strips, it acts like a skin graft and frequently will improve the ability to heal, and it'll go faster. So that's one case where something might look devitalized, but it's not really.
Oh, well, thank you. Great follow-up. Next question. Does icing a wound help or hurt healing?
So I just said that keeping the wound warm actually helps the healing process. If there's an injury, such as a contusion, so lacerations can be caused by something cutting you, like a piece of glass. Those actually heal pretty well because they're like surgical wounds. They're very clean. They're cut nicely. The tissue is healthy on both sides of the cut. And if they're allowed to lay next to each other, they'll heal pretty rapidly. Within 48 hours, a lot of lacerations like that are watertight and are starting the healing process. But if you cut yourself by being struck by a blunt object, let's say you drop a log on your shin and you have a big wound there, those wounds can be very difficult to heal because the contusion will cause swelling. And so ice is good to prevent swelling. So for the first 48 hours, you might put ice to a wound like that. And then I would encourage normal thermia or even a little bit of warming to the wound. Please be careful about don't be adding heat to your wound. A lot of diabetics that we have come in with falling asleep in front of with a heating pad on their foot or in front of a heater on their foot, and they get big blisters on the bottom of their foot because they don't have intact sensation. So I'm not encouraging adding heat. I'm encouraging maintaining the normal thermia that you would normally have in your skin. So ice is good for things that tend to swell for the first 48 hours or so, and then gentle heat or normal thermia is good to promote the healing process.
Great tip. Thank you. Next question. Are there any products that help numb a wound at home so you can clean it thoroughly?
That's a good question. I'm not aware of any home products. I'm sure that there are some, but I'm not sure which ones are actually indicated to spray into an open wound. There are sprays and like benzocaine and things like that that are made to help numb skin, but I'm not sure about. Oh, actually, I think Bactine may have a product that's an antiseptic and may also have a numbing product in it, and that may be one that could be used. Washing a wound is a good way to get debris and things out of it. Not all debris will come out that way. And if there's debris left behind and you just can't get it out, then going to a place where it can be formally numbed up with xylocaine and actually scrubbed out with a small brush to get all the debris out. Because if foreign material is left, if it's left in the dermis, actually, you can be left with tattooing from for example, if you leave little pieces of dirt or tar in there, you can actually get tattoos from it if it's in your dermis. But it also sets up a nidus for infection because the bacteria like to live in those little nooks and crannies that antibiotics and other things can't get into. So it's important to get all the devitalized tissue out. And so if there's a lot of it and you can't get it out just by simply flushing the wound, and actually you can probably flush the wound without putting numbing medicine in most times. But yeah, there may be some over-the-counter things. Like I said, I think I remember that Bactine may have something in it that's numbing. We try to put as few chemicals in the wound as possible, but that may be an exception if you want to do that to make it a little bit easier to do a dressing change or to clean out the wound.
Great, thank you. Next question. Is there any problem with using the medical version of crazy glue?
Well, yes, it's not approved for that. So the non-medical stuff works because I won't say that I've used it, but in a pinch, it has been used. Never on a patient, of course. And it's very similar, but it's actually a different chemical. And I believe that the non-medical crazy glue may have some carcinogenic properties in it, so it
Ooh.
would be frowned upon to suggest using it in the wounds.
Well, thank you.
They're similar though. They're a type of cyanoacrylate, but again, I think that they have some chemical in that's not compatible with good health, and so the ones that are made to be put on the skin have been FDA tested and approved, and so should be more suitable. So I would frown on. I would not recommend that.
Thank you. Good recommendation. Thank you. Well, thank you, Dr. Canto. This was really a great talk. You have a lot of great tips for wound care. I appreciate that. And then I appreciate all your work with patients who have those chronic wounds. So thank you very much.
Thank you so much. I encourage people to come and visit us if they have a wound. It's perhaps not the best way to spend an afternoon, but it's a lot better if we get to the wound earlier and we can take care of it and help you heal faster and get out and do what you really want to do.
Excellent. Good point.
And we're everywhere.
That's
But
right.
We're not at Noble yet, but maybe in the near future we'll be at Noble too. So
Wonderful. Well, thank you for your work, and thank you for everyone who joined us tonight.
thank you everyone for attending. I appreciate it. I hope it was helpful.